Welcome back. And upon directives of President Abdel Fattah al-Sisi, recently Minister of Higher Education, Acting Minister of Health, Dr. Khalid Abdul Ghaffar, he issued a decree to include new categories under the umbrella of the General Authority for Health Insurance. And on this very important topic, we're very delighted to be having with us our dear guest, Professor Dr. Hoda Rezkana, Professor of Intensive Care, Faculty of Medicine, Cairo University. Good morning, Dr. Rezkana.
Good morning, good morning.
Let us first talk about the special care given by the head of state to improve the quality of the health file and the health care for Egyptians in general, before we get into details.
Well, as a matter of fact, basically, we are improving the status of life and the level of the living of the Egyptian. He put this as a remark to his steps in directing this country. So the best and the ultimate service will be to provide health services and, of course, higher quality of life, and also improve the level of the living to increase their income. Nobody can make any effort except if he's healthy, and nobody will tackle a lot of services to work and to improve his income except if he enjoy a good and healthy system in his body. So medical insurance is a must for equality of rights according to our doctor. I mean, if you have if we can see your rights here in Egypt, you have to enjoy living, healthy living, and health service should be obtained, and also an income which provide the needs you needed for you and your family. So the best issue is that we ensure that health service is provided in the ultimate manner. That's why he takes a very good care about this item, because we wouldn't move here or there except we have a healthy young generation and healthy mother and healthy father, and the grands also, they should enjoy it.
Of course, it is important to raise the living standards of the Egyptians and the citizens, and the level of care provided for them, especially when it comes to health care. This is one of the most important files and at the forefront of any priority. And this is what exactly President Abdel Fattah al-Sisi is trying to do now, is has been implementing several projects even in Upper Egypt, inaugurating many health facilities and hospitals and healthcare destinations in order to introduce a whole profile for a healthcare insurance, which is coming up very soon.
Well, as a matter
if
of
not
fact,
started up yet.
Yeah, but it is, he's preparing for that. I mean, each area, governorate in Egypt now should enjoy a university hospital, a hospital which belongs to a higher caliber of medical doctors, and they provide certificate, of course, they manage for the exams and for the medical doctors and training courses. That's why you can provide a healthcare provider, service provider, who is aware what he's doing and how to check the manner of the status of the people around him. And this hospital should be provided with a whole system of services. I mean, if there are any CT scan provided, the blood examination by all sorts should be there in this place. Examination for GIT, cardiac, health, lung, all this providing tools to check and to detect any deformities in the body of the people. And these hospitals should be scattered in all the governorate. At least each suburb, they have a service office with a GP, doctor, general practitioner, who got a certificate to examine generally and make a primary diagnosis. And the one who received this service should take this assessment, and primarily if he's under the diabetic or hypertensive or all that stuff, they will be categorized, and then the services of the diseases they suffer from, it will be treated accordingly. So what we need is to provide each governorate with the sum of GP who are scattered in the governorate, and provide primary examination for the patient to start with. And each candidate who enjoy this insurance service should have this card according to his birth and according to his neighborhood, and that's why he is very easily calculated and approved. Because you can say in this governorate, say Sohag or whatever, there is a summation of diseases which is including diabetes, hypertension, all that stuff. And you get the number, because you got everybody coming to this service, he will register and will be examined accordingly, and that's why he is ready to be calculated, and very easy. You can ask the Minister of Health how many patients with diabetes in Sohag, he will give you according to the list provided by the offices or the clinics there. So it's a must to detect all these illness, and it's a must also to know what quality of medical service they need. You don't need in each place to have a resection for tumors, hospital for tumor resection, no, or a radiation service. You can summate it and see the least number of people suffering from tumors in certain area, which can be served by other variety of diseases. Something illness like in brain, something like vascular, something like lung diseases, because there is a lot of areas which is not ventilated properly. And that's why we had to sacrifice and see, I mean, you have to shake and see how many patients suffering from hypertension, how many patients are suffering from diabetes, how many patients suffering from neurological disorders, or old age with the outcome of the old age.
So in other words, digitalizing the healthcare is a must and importance now, and this is what exactly is the government
Steps.
is doing to digitalize the complete makeover of the health system through a digitalized project or a system
Yes.
that is going to control all the files of the patients.
Yes.
But also, we talked about the importance of establishing healthcare facilities and hospitals, and this is what President Abdel Fattah Sisi had been doing earlier, and he inaugurated several hospitals earlier, before in Upper Egypt, and this has impacted in saving lives, saving effort of trips going
Saving
back
money.
and forth to Cairo,
Yes.
by people who could be low income brackets and
Yeah.
wouldn't be able to, and even in not in good health, to be able to travel every day
Yeah.
to get treatment. So how do you see the importance of
It's a mandatory step, of course, because you have to eliminate the diseases. You have to eliminate the difficulties the patient suffer from. I mean, they travel a long distance to have a medical checkup for a tumor in the Cancer Institute. So why we do that? We have to provide these people in Upper Egypt, whatever the governorate is, with service which diagnose and can also treat the tumors. So this is a bless, because first of all, you save the energy of this patient, saving his money because traveling, Sometimes they don't have anybody in Cairo to
Exactly.
rest or to stay for another day or 1 week to complete his checkup. So it's a very, very exhausting process, and it's also add to the patient suffering because he's very, very sick, and sometimes people they wait
It
till the
might have
end.
bad side effects,
And
or
also
or a
you have a
relapse in his health
complication of
complications.
this situation is very, very frequent, and I don't see that again. I hope a lot of people are scattering around the hospitals on chairs or no chairs, whatever, waiting for their turn. So it's a very a humane factor that you care for these people. So providing hospitals which is equipped with lab and diagnostic tools, x-rays, and diagnostic blood circulation, and health for the lungs, and health for the liver diseases, and lab for the liver function test,
Exactly.
and lab also for the renal, because these areas sometimes the water add to their suffering. They get a lot of stones in the renal system because they have water which is not distilled, or maybe in the desert, which a lot of salt or minerals there were not regulated, and the heat of the sun, so you got dehydrated, which helps in formation of the stones, renal stones. So this is a complicated process, but sometimes all develop the sickness the patient presenting to you for this. Also the young students, they should have their card according to the school insurance system. It's very important because they receive a free service since a long time in Egypt. And they were having a hospital, Cairo University Hospital, for students which operate on the young generation till the end of the higher school years. I mean, he get graduated from everything, if he got a diploma or whatever, and he got history written in his medical card and registered according to the area coming from. So it's very easy to calculate, eliminate diseases, make sure that there is a healthy service or not. If the people, we have to listen to them because the people tell you the truth. If I don't have the medical treatment I should have, the drugs submitted to him, it's not the typical where the specialist wrote it for them. So they say why it's not the same drug. Sometimes the pharmacists in this hospital say I don't have that in my pharmacy here. We will ask for it next week or whatever. So these areas for the services should have an information system ready to go. Why? If you had an emergency for a renal stone or emergency for gallbladder stone, females there are fatty and they have a gallbladder stones frequently because the fat and the sedentary life, I mean, she's sitting all the time, she's not moving around. She has to provide some system to move, and then she comes to you with a lot of diseases on top. Chronic colitis, spastic colon, of course, spastic colon, because she's not happy and miserable. So the colon announced he's angry also. So you have a group of signs and symptoms which makes this lady non-functioning lady at home. She's always in the bed. So if she come for health service, and she used to be, say, employed by the schools or employed by the Ministry of Education or whatever, she has the card and she can go ahead and submit this card and ask for medical insurance, and also medical examination, which is subsequently by examination and then blood lab analysis, and then she got the final diagnosis, and accordingly she will receive her treatment. So this is a great step by the President. I hope all the systems of the Ministry of Health can support and act according to the system performed all over the world, because we are not inventing the wheels. We are already running.
That's true.
We need to run the wheels in the proper way in our country. I think by a lot of, since a long time, there were a lot of big doctors. I know a professor, and his father is the Basha. He used to make the examination with 5 pounds. And I was very sad to see his hospital in turn around. I mean, they turn it down, and I don't know, put it as a parking area and for cars.
But then we need also to talk about the health insurance system and its importance for every nation, as a foundation for every nation, and following the successful footsteps. For years, we have been leading good examples for countries, especially with our Egyptian calibers.
Yes.
In the medical arena, and as we see that they're leading the front lines in worldwide when it comes to healthcare. But following the footsteps of successful experiences when we come to a complete health insurance system.
Well, accordingly, the proper way to visualize the governorate you are serving this, you're offering this service, you should have a list of their organization and the list of the employee in this organization, and according to the age group and the area they're coming from, they should be examined and redistributed for the service. So when you come for this service, the area of frequently facing the patient is that they have a delay in the service. They always complain, there is a lot of people, and we are in this queue, we need help, and we need to make it faster. So that's why it's important to eliminate this factor and make the patient in groups, which comes to receive the service from our 8 in the morning till 12, and then after that break for the examination, and then from 1 till 5, and from 5 till 9. So you have 3 areas, time scheduled. You can see and generally examine the patient, and you can speculate provisionally what is the diagnosis in this case, and then refer it to the specialized doctor.
On that note, Professor Dr. Hoda Rezkana, Professor of Intensive Care, Faculty of Medicine, Cairo University, thank you so much for coming. All the best of luck.
I am very happy to see you, and I
Wish
you a happy New Year, and all Egypt happy New Year, and our President happy New Year.
Same to you. And I guess this would bring us now to the end of this first segment. We're going to go to a short break, and we'll come to continue the breakfast show, so stay with us.